Hello friends, this is Dr. Binayak Sen, consultant urologist, Peerless Hospital, Kolkata. My patients present with a number of problems, of which the most important being getting up to the toilet many times at night. This may range from a little bit of urine to a huge amount, and sometimes wetting the bed. The next most common is having difficulty in passing urine, from slow stream, drops to a complete stoppage. The other thing is sometimes they notice there's a little blood coming in his urine. There are also other factors like going to the toilet many times and waking up at night. Patients are more troubled by getting up at night and losing sleep. Urinary problems are divided between men and women. In case of women, it is mostly due to overactive bladder or incontinence due to weakness of the holding mechanism. So we can divide them into urge incontinence and stress incontinence. In case of men, it is mainly outflow obstruction, and outflow obstruction leading to either poor flow or urgency frequency syndrome, leading to getting up many times at night, which I have already said. I also run a few tests, which includes a routine urinary examination, ultrasound of the kidneys, bladder and prostate, uroflowmetry, and ask them to maintain a voiding diary, which gives me a lot of information regarding how many times they get up at night and how frequently. I also do a few blood tests, including a PSA, which is prostatic specific antigen, urine for routine tests, and urea creatinine. When I see the patient with these symptoms, there are a lot of treatment, which includes a medical treatment as well as surgical treatment. These days there are an array of medical treatments available, which includes alpha blockers and anti-muscarinic drugs. To name a few, like tamsulosin, silodosin, and others. When the patient presents with these symptoms, there are a lot of treatments available, of which medical treatment plays a big role. If medical treatment fails, then we have to consider surgery. Certainly it does. The earlier the better, and patient presenting early can well be treated with medical drug treatment and drugs. If unfortunately they present late, most of the time medical treatment fails and we have to consider surgical option. These days the surgical option is now mostly endoscopic, which means no cutting operation unless the gland is very large, and then we may consider open prostatectomy. In all other situations, we do endoscopic resection of prostates, and of the endoscopic there are various forms of energy used. The most common is called the TURP, using monopolar diathermy. Then there is the option of using the laser, where you do an enucleation of prostate, which is called the HOLEP. Also, there is the bipolar resection, where plasma is used for resection of the prostate. Happily, the side effects are few and far between. After the surgery, patient has a catheter, which is removed within a couple of days. They might experience a little bit of burning sensation, but not a lot. Other than that, the surgery is pretty much pain-free and without much complication. This involves stones which form in the kidney, which sometimes migrate down the ureter into the bladder. Kidney stones by and large are pain-free, but when they come down into the ureter, which is the passage from the kidney to the bladder, they are excruciatingly painful. In fact, it is one of the most painful conditions known to man. It depends on the location of the stone. If the stone is inside the kidney, as I have said earlier, generally it is pain-free, except a little bit of discomfort. But when it goes down the passage which connects the kidney to the bladder, there is pain which is from the loins on one side, depending on which side the stone is, going down to the groin. And also, if the stone gets lower down, there might be little bit of burning sensation and passing of blood with the urine. Kidney stones needs various investigations to diagnose. When they come to me with a pain in the loins, the first investigation that I do is a non-contrast CT scan, which clearly shows the position of the stone, the size of the stone, and how hard the stone is. Kidney stones or ureteric stones have various types of treatment. I would first deal with the kidney stones. Small kidney stones do not require any surgical intervention, and with plenty of water and drugs, the stone might pass into the urine. This is called the medical expulsive therapy. This is also useful for small ureteric stones. With this drugs, various types of drugs are available, and we also give painkillers and wait if the stone is passed through. Going back to the kidney stones, small stones can be treated with lithotripsy, which is like using a vibration to pulverize the stone, or there may be bigger stones treated with PCNL, which is percutaneous nephrolithotomy, in which case the patient is made to lie on his face down, and a small hole is made on the back, and it is through which telescopes are introduced and the stone is fragmented. In other words, a keyhole surgery. In case of ureteric stones, if the stone passes with water, which means a medical expulsive therapy, nothing needs to be done. If on the other hand, patient keeps on having pain, we treat with ureteric stones like ureteroscopes and use a laser to fragment the stone. Stenting means a little pipe which is kept between the kidney and the bladder. After ureteric surgery or stone surgery in the kidneys, the passage is kept patent by using this so-called stents. The difference between cardiac stents and the ureteric stent is that this is not permanent and is taken out after a few weeks. So there is no worry that the foreign body is left inside the body.